Broadcasting from Studio 7, this is Radio Chelsea News with Seán McCarthy. A Texas hospital patient has tested positive for Ebola, making the patient the first case diagnosed here in the United States. The test was conducted at the State Public Health Laboratory in Austin, Texas. The patient is an adult with a recent history of travel to West Africa. He developed symptoms just days after returning to Texas from West Africa and was admitted into isolation on Sunday, September the 28th, 2014, at Texas Health Presbyterian Hospital in Dallas. According to a CDC press release, the ill person did not exhibit symptoms of Ebola during the flights from West Africa, and the CDC does not recommend that people on the same commercial airline flights undergo monitoring, as Ebola is only contagious if the person is experiencing active symptoms. The person reported developing symptoms several days after the return flight. The Center for Disease Control and Prevention confirmed the positive result. CDC Director Dr. Tom Frieden spoke at a press conference.
As long as there continue to be cases in West Africa, the reality is that patients travel, individuals travel, and as appears to have happened in this case, individuals may travel before they have any symptoms. One of the things that CDC has done in Liberia, Sierra Leone, Guinea, and Lagos is to work with the airport's authorities. So 100% of the individuals getting on planes are screened for fever before they get on the plane. And if they have a fever, they're pulled out of the line, assessed for Ebola, and don't fly unless Ebola is ruled out. This is one way to make sure that the airplanes themselves are safe during transit and the airlines are willing to keep flying. But that doesn't rule out a situation like this one where someone may have was exposed and then came in while they were incubating the disease but not infectious with it.
Ebola is a severe, often fatal disease. Early symptoms of Ebola include sudden fever, fatigue and headache. Symptoms may appear anywhere from 2 to 21 days after exposure. Ebola is spread through direct contact with blood, secretions or other bodily fluids or exposure to contaminated objects such as needles. Ebola is not contagious until symptoms appear. CDC Director Tom Frieden.
Today we are providing the information that an individual traveling from Liberia has been diagnosed with Ebola in the United States. This individual left Liberia on the 19th of September, arrived in the U.S. on the 20th of September, had no symptoms when departing Liberia or entering this country, but 4 or 5 days later, around the 24th of September, began to develop symptoms. On the 26th of September, initially sought care, and Sunday, the 28th of September, was admitted to a hospital in Texas and placed on isolation. We received in our laboratory today specimens from the individual, tested them, and they tested positive for Ebola. The state of Texas also operates a laboratory that found the same results. The testing for Ebola is highly accurate. It's a PCR test of blood. So what does this mean? The next steps are basically threefold. First, to care for the patient, and we'll be hearing from the hospital shortly, to provide the most effective care possible, as safely as possible, to keep to an absolute minimum the likelihood, the possibility that anyone would become infected, and second, to maximize the chances that the patient might recover. Second, we identify all people who may have had contact with the patient while he could have been infectious. And remember, Ebola does not spread from someone who's not infectious. It does not spread from someone who doesn't have fever and other symptoms. So it's only someone who's sick with Ebola who can spread the disease. Once those contacts are all identified, they are all monitored for 21 days after exposure to see if they develop fever. If they develop fever, then those same criteria are used to isolate them and make sure that they are cared for as well as possible so that they maximize their chances, and to minimize or eliminate the chance that they would infect other people. The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country. It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here. It does reflect the ongoing spread of Ebola in Liberia and West Africa, where there are large numbers of cases. And while we do not currently know how this individual became infected, they undoubtedly had close contact with someone who was sick with Ebola or who had died from it. In West Africa, we are surging the response not only of CDC, where we already have more than 130 people in the field, but also throughout the U.S. government. The president has leaned forward to make sure that we're acting very proactively there, and the Defense Department is on the ground already strengthening the response. We're working with USAID and other parts of the U.S. government, as well as with a broad global coalition to confront the epidemic there. But ultimately, we are all connected by the air we breathe. And we are invested in ensuring that the disease is controlled in Africa, but also in ensuring that where there are patients in this country who become ill, they're immediately isolated, and we do the tried and true core public health interventions that stop the spread of Ebola.
Dr. Edward Goodman, epidemiologist of the Texas Health Presbyterian Hospital, clarified during the same press conference that Ebola is not transmitted through the air we breathe.
I want to correct one statement that may have been misinterpreted by Dr. Frieden when he commented on the air we breathe. Ebola is not transmitted by the air. It is not an airborne infection. Texas Health Dallas is a large community hospital with a robust infection control system that works in close cooperation with the Dallas County Health Department, the Centers for Disease Control, as well as other epidemiologists within the system and in the community. We have had a plan in place for some time now in the event of a patient presenting with possible Ebola. Ironically enough, in the week before this patient presented, we had a meeting of all the stakeholders that might be involved in the care of such a patient. And because of that, we were well prepared to deal with this crisis.
The Texas Department of State Health Services is working with the CDC, the local health department, and the hospital to investigate the case and help prevent transmission of the disease. The hospital has implemented infection control measures to help ensure the safety of patients and staff. Speaking at a press conference, Commissioner of the Texas Department of State Health Services, Dr. David Lakey, identified the patient's strain of Ebola as Ebola Zaire.
Our laboratory, the Texas Public Health Laboratory in Austin, has a specially trained team to handle high-risk specimens like this. We were certified on the 22nd of August to do Ebola testing. At 9 o'clock this morning, we received the blood sample. All the controls were within the expected ranges, and the PCR was definitely positive for Ebola Zaire, and we got that result back at 1:22 this afternoon. I want to reiterate that we have no other suspected cases in the state of Texas at this time. But we are closely monitoring the situation, and we're ready to assist in any way that is needed. We've been in significant contact with the hospital, with the local health department, and the CDC, and they have our full support as we work through this situation, and we're committed to keeping Texas safe. So again, I want to thank the CDC, the local health department in Dallas County, and the hospital for the work that they're doing, and we're working through this situation together.
The CDC recommends that individuals protect themselves by avoiding contact with the blood and body fluids of people who are ill with Ebola. The Texas Department of State Health Services also encourages healthcare providers to ask patients about recent travel and consider Ebola in patients with fever and a history of travel to Sierra Leone, Guinea, Liberia, and some parts of Nigeria within 21 days of the onset of symptoms. For Radio Chelsea News, I'm Seán McCarthy.
Radio Chelsea News with Seán McCarthy.
Like us now on Facebook.com/Radio Chelsea News. Follow us on Twitter at Twitter.com/Radio Chelsea NYC. Radio Chelsea, New York's informative alternative.
Radio Chelsea.